Good. How are you? Yes.
Very rich text photo because you'll see it on style like things.
Yeah, we're having all kinds of conversations that I should have been more cognizant of. All right, I'm ready. Just tell me when you're ready.
Okay, ready.
I'm reconvening the Finance Committee, special meeting with public hearings. This is our first public hearing. We will be conducting another public hearing on Tuesday, August 15th at 9 a.m. here, at the same location. I'm going to ask the secretary to please call the roll.
Director Deere,
Director Deere is here.
Director Harrington,
Present.
Director Robinson is absent. Director Story,
Present.
Chair Ryder,
Present.
and for the record, those directors also present. Director Webster Cross, present, and Chair Taylor.
Present.
A quorum is present.
Great, thank you, Debbie. The first item on our agenda today is to receive an overview of the budget presentation. And are we going to you first, Mr. CEO?
Since having given the statement before in the opening of the hearing yesterday, I'll leave those comments for the record and just really want to say that we're pleased to be here. And I will, with me today, joining us is Pam Cassera, our Chief Financial Officer, who will go over the presentation and the budget structure.
All right. Pam, the floor is yours.
Great, thank you. Pam Cassera, Chief Financial Officer, and Chair Ryder has authorized me to speed read through this, so I'll try to be brief. We're going to start with fiscal year 2023 accomplishments. I'm not going to read all these, but I do want to point out a couple of things that did have impact on the budget for this year. Starting on the upper left there, a lot of this has to do with expansion of services. And you can see advanced service expansion at Provident and ACHN locations in cardiology, general surgery, gynecology, plastic surgery, pain, rheumatology, thoracic surgery, and vascular. Down towards the bottom, you can see a dollar sign. We exceeded our county care member utilization of CCH services revenue targets in the first quarter. On the right side, we had 2,500 plus retention bonus agreements finalized. We performed our first MitraClip and TAVRs. We reduced our accounts receivable days from 83 to 54, and we continue to serve the health needs of thousands of asylum seekers. Next slide. So looking ahead to 2024, again, the key initiatives are around growth. At the top left there, continue our expense management and revenue cycle improvements, expand services at Provident, enhance recruitment initiatives and job fairs, grow comprehensive service lines for oncology, cardiology, and neurology, and on the right, mitigate the impact of redetermination on Medicaid members. Next slide. So as we built the budget, these are our key assumptions. We started with fiscal year 23 projected volume as the run rate, as the baseline, and we added increases in surgical cases and procedures at Stroger and Provident, continued the ramp up of the service lines, cardiac, neuro, and cancer. We kept ED in observation and births flat since we haven't seen a lot of growth there. And then we layered in our rate increases, 3% for county care, per member per month capitation rate, and 4% charge master increase in select services. We layered in the negative impact of the Medicare proposed rule, added the county tax allocation increase of $10 million, and then reduced the county care membership to 364,000 due to redetermination. Next slide. So this is how that translates into the volumes. Again, we looked back at 2021 and 2022. We looked at what the budget was for this year and where we were projecting to come in and if we were meeting or exceeding that or not. And then we landed on the budget for 2024. And as you look down through there, those increases are very conservative. They're between 1 and 2.5%, with the exception of county care, which is actually, as I mentioned, a decrease from this year projected. Next slide. This is how that all translates into dollars. You can see we're coming in at a $4.257 billion proposed budget for next year, a $264 million increase, or 6.6%. But that is a decrease of $643 million from this year projected, or 13.1%, again, due to redetermination and the anticipated potential shift from Medicaid back to charity. Next slide. Moving on to the expenses. The health fund, as you know, needs to come in balanced. So again, we are balanced at $4.257 billion, an increase again of $264 million, or 6.6%. And then on the position side, a 308 position decrease, or 4%. And this is due to a right-sizing exercise we did over the course of the year, looking at vacant positions only, and a combination of using productivity, the age and how long the position had been vacant, whether or not HR was recruiting for it. And what we tried to do there was create a pool for the future need, pool of vacant positions for the future needs of the organization. Next slide. So we'll quickly go through each office, starting with correctional health, which is CIRMAC and Juvenile Detention Center, going up $15 million in expense side due to the rising number of detainees needing care, expanding services. And then on the right there, a decrease of positions 56, which is 44 that were removed or retired, and 12 were reclassed to health system administration. Next slide. Provident is going up $19 million over this year's budget, primarily again around expanding services, neurology, stroke, GI, women's services, physical therapy, occupational therapy, and speech, and then going down 21 positions, 10 completely removed, and 11 reclassed to health system administration. Next slide. Outpatient. Again, the strategy, is you can see, is around expanding services. Outpatients going up $50 million from this year's budget. The plan is to expand virtual care and urgent care, radiology services, and continue to serve the health needs of the asylum seekers. And then on the positions, going down 77, 53 vacant FTEs removed, and 24 reclassed to health system administration. Next, Stroger. Of course, Stroger is our biggest office. It's going up $265 million. Again, continued ramp up of services, cardiology, neurology, and cancer. And then an increase in inflation costs related to supplies, lab, registry, medical, pharmacy, et cetera, due to the increase in volumes. And then 191 decrease in this office, 87 FTEs removed, and 104 reclassed to health system administration. Next, public health. The only piece of public health that is in the $4.3 billion budget is the top line that says health fund. The top line is going up a modest $2 million. The bulk of their financial support comes from grants, as you can see there. And the positions from the health fund going down 50, 38 removed, and 12 reclassed to health system and administration. And then we've listed the top 3 grants there below. Next slide. Health administration. Health administration is going up $32 million. On the expense side, we are establishing the Office of Clinical Research to support research operations for the health system. And then we are establishing a position control department to balance the organizational goals relative to vacancies. And that 95 position increase is due to the reclasses from across all the offices for the pending needs of the health system and creating that pool of positions that I spoke about. Next we'll move on to health plan services or county care. County care is actually going down $122 million in their expense year over year. This is due to the decrease in medical claims, due to the projected membership decline related to redetermination. All other expenses are in line with prior years, and we are moving 8 positions over to health system administration. Next slide. This slide, as we've showed in the past, just shows our anticipated decrease over the course of the year, starting at the high of over 400,000 and gradually decreasing to the 348 by the end of the year due to redetermination, and the average used in the budget was 364,000. Next. And lastly, this is the projected membership split across the different plans that total up to the 364,000, as well as the contribution margin per member per month of each plan to the health system. Next slide. And lastly, we just like to remind everybody of our budget calendar. We started off, as Mr. Rocha mentioned, with a special finance committee. We are having these hearings this week and next week, and then our actual finance committee for budget, the budget will go to the finance committee for consideration and on the 18th, and the board on the 25th, the 17th, sorry, and the board on the 25th. And that concludes the budget presentation.
Thank you, Pam. Next would be that we are expecting. So do we first have anyone registered for in-person testimony, Debbie?
We do. We have 2 people registered for in-person.
All right.
The
Great.
first,
Go ahead.
the first speaker is Beulah Brent. And just a reminder, you have 3 minutes. When you have 1 minute remaining, I'll remind you, and then when your time is expired, I'll let you know.
Thank you so much. Thank you so much for this invitation. I am truly honored to be here to talk about our relationship with Cook County Department of Public Health and Cook County Health. I am a retiree from Cook County, so I actually did my 30 years, and I am so honored to be able to be back and continue to do my work. I started off again during the pandemic. My organization is Sisters Working It Out. We're a breast cancer organization, and we actually work with women to make sure they get their mammogram. I was currently, well, before I retired, I was actually the manager of a mammography department, and to watch to see how many women was unable to get that mammogram, actually, I found my desire there. So after I retired, that's what I'm doing currently. But during the pandemic, we kind of pivot into the COVID world because of what was going on with COVID. So I started off as a contact tracer, and during that particular point, I love being a contact tracer. So when the opportunity came for us to be able to kind of pivot out and help especially the high-risk women that we were serving, that was a great opportunity to start to work with County. And I want to actually give thanks to Dr. Hasbrook over there. He actually did some community service just to hear our concerns because we was complaining at some point. But the whole thing is because of this relationship, we have been able to actually meet with so many other CBOs. And I tell you, the things that the CBOs have been doing in the community might be things that our regular employees have been unable to do. So to be able to connect with the other CBOs, we have the one that we have here is Dr. Nayoka Farmer, who's actually in his hands a resource. So what we do, we find out not only does patient have the problem getting mammogram, but they can't do mammogram if they can't have food to eat or pay their bills. So we've been honored to not only have this contract, but contracts with other private industries that help us not only get free mammogram, but also help us provide food, COVID testing, PPEs, all of these things we've done. And up until today, from January up until today, we have done over 30 events with other CBOs or the ones that we have planned for ourselves. So I hope that whatever it needs to do, you need to do to pass this budget. We are so proud to be a part of it. Thank you.
Thank you. And I'd like to say thank you for your years of service to CCH and the citizens of Cook County, as well as the work that you and the other sisters are doing here to serve all of mankind. So thank you.
Thank you. Next speaker.
The next speaker is Neoka Farmer.
Hello, my name is Dr. Nyoko Farmer. I am the founder of In His Hands Resource Center. I'm grateful to have this opportunity to speak today and be a part of the advisory board under Marcelino. I'm grateful for Alice and Kaylin to always be present to help us in the community, to give information out to clients that need the information. To know better is to do better. Like Ms. Billy was talking about, during the pandemic, a lot of things had changed and came to the surface of the needs that's in the community. Our organization is a resource center, and I connect the dots. Our organization fed over 100,000 families during the pandemic. Also, we are a service center for Salvation Army. We also are part of 211 United Way call center. And the need is real. We're part of the Build Healthy program. And what I can say, housing is healthcare. And that's like the key thing. And food insecurity is a big issue in the Southland because it's a lot of food deserts. You see dialysis popping up everywhere, but you necessarily not see the grocery stores or the farmers market popping up to have healthy food for your children and for your family. So we try to change the trajectory of that and do it with dignity and respect, regardless of what class you're in, you know. Everyone needs that helping hand, and I believe in true partnership. So with this union, whatever, like Ms. Dewey said, that needs to be done to pass the budget. Please take that in consideration. Everyone got hit hard regardless where you at in life. And so now we pivoting to a new day, you know, and that information and the funds that was available then should still be available now to be able to start a new life, or how do we rise above? So thank you for your time.
Thank you.
Thank you.
Next
Thank
speaker.
The remaining speakers are virtual.
Do we have any other speakers that would like to speak, in-person speakers? Hearing none? Okay, let's go to the virtual ones.
Okay. The first speaker is Elder Lanyard Smith. Elder Smith, are you there?
Yes, I'm here. Can you hear me?
I can hear you and we can see you.
Okay, well, thank you all for having me today. My name is Elder Lanyard Smith. I am the community engagement leader here at the Apostolic Church of God. The community engagement ministry is called the Evangelism of Grace. And I want to just say that we have worked very well with Marcelino and his team over at the Provident Advisory Council over these past years. And yes, they are doing such a great work by providing such great information to the community. We've been able to enjoy collaborating on past events, community health fairs, and things of that nature, being able to utilize the doctors from Provident to come into the community and talk with our seniors, just adding a lot of value to just the whole healthcare mental wellness component, as I should say. The information that we receive from the council is invaluable and very much needed in our community right now. Marcelino and his team have always been very supportive to the Apostolic Church of God, very accessible. Anytime we need anything, that team is there to help us. So we look forward to our continued partnership with the Provident team and the advisory council, and that we considered it to be a whatever's needed to consider to approve this budget for them, for us. I ask that you do so. Thanks again for having me today, and take care.
Thank you. Our next speaker, Debbie?
Our next speaker is Kiara Williams.
Good evening. My name is Kiara Williams, and I am the case manager at Family Focus Inglewood. We are a nonprofit organization that services children, youth, and their families with pretty much wraparound services. We've been partnered with Cook County Health for a while now, working primarily closely with Kaylin and Marcelino. So I do want to just shout them out and thank them for the support that they give our organization, the outreach, the education that they provide for us. And that kind of brings me to my points of why Cook County Health has been so important to us, why it's been a great partnership. A lot of the families that we service, they are low income, so their primary access to healthcare comes from county care, Medicaid programs. And so having that access through these programs and also being able to go to different facilities in our communities, for example, the Inglewood Health Center has been a big support just in terms of family well-being for our participants, but also even for our staff members that work in Inglewood, live in greater Inglewood neighborhoods, things along those lines. We also get our healthcare through Cook County Health and things along those lines. So their programming has been very helpful for us in terms of getting access to healthcare, making sure that our babies have access to those well-child checkups, and our moms have access to women's health. And then in addition to that, we also have partnered with them through different outreach and recruitment events. And that has been helpful too, just so that other people in the community can make sure that they know that we are a resource as well. So I do just want to thank Cook County Health for all that they have done and being a great partner. And as many other folks have said at this meeting, that whatever it takes to get this budget passed, we are in full support of, just because of how great they are in our communities and in our lives. Thank you.
Thank you.
And the final speaker is Cecile DeMello.
Hello, my name is Cecile DeMello. I'm the Executive Director of Teamwork Inglewood. We have been working very closely with our partners at Cook County Public Health, especially with Kaylin and Marcelino. We have been leveraging the community work of the Inglewood Quality of Life Plan, which is a community-driven plan that shares with residents and stakeholders who have been trying to work on key issues to address health and wellness concerns in Greater Inglewood. They've been an amazing partner. So like some of the colleagues before me said, their participation in community events and being able to get information out to residents has been key. But there's another piece I'd like to talk about, is just that opportunity and that growth around collaboration, right? So we get to brainstorm and implement and pilot educational programs, grassroots, physical exercise initiatives, and being able to connect people straight to a clinic partner or to health practitioners is something that's really remarkable and helps us to really create a larger impact. So I'm very grateful for the partnership we have, and I hope that we can continue to grow and that this budget supports our the growing initiatives that we have in communities. This grassroots participatory collaborative effort that allows for programs to be incubated and for us to really leverage our strengths to create those type of programs that really get to the heart of what our communities need. Everything from health education, like I said, to physical exercise, to being able to connect people with practitioners. So thank you so much, and I really look forward to the journey.
Thank you.
Mr. Chair, may I? Mr. Chair?
Yeah, Director Dare?
Yes, I just wanted to highlight the comments that Ms. Cecile DeMello made and congratulate her on the fantastic work that she is doing in Inglewood, Teamwork Inglewood. She's mixed breed. She's a West Sider and then a South Sider, and we're delighted of the work that she's doing, but even more so, the work that she's doing with Cook County Department of Public Health. Cecile, keep up the great work. Continue the collaborations. I know that they're bigger and better things on ahead, and keep on having a heart for the people. We're appreciative for the work that you do with us. Thanks so much.
Thank you.
Thank you, Director Deere. Do we have any other public speakers?
We do not have any other registered speakers.
All right. Since we don't have any other speakers, we are going to recess the meeting to Tuesday, August 15th at 9 a.m. So I want to thank all those who attended and spoke today, and we will see everyone on Tuesday. Thank you.
Thank you.